Yes, let me introduce Dr. Charles Elder. Dr. Charles Elder and Dr. Leslie Elder, they have been affiliated with MIU for a long time. Dr. Charles Elder is currently the executive director for the fellowship, the Integrative Medicine and Ayurveda fellowship. So some of you who are taking the fellowship courses, you will actually talk to Dr. Charles Elder and Dr. Leslie Elder. We have been now knowing each other for almost last more than a year. So I consider him my mentor also. Fortunately, he has agreed to come to our global summit in Orissa in January. And let me know if I'm missing any other introduction, but they are really very much dedicated into the integrative Ayurveda, which we have been talking since yesterday. We had all different kinds of CME. Everybody enjoyed the CME, but Dr. Charles Elder and Leslie Elder, they are going to talk about the importance of Dincharya into the how we can kind of integrate that component, the philosophy of it into our day-to-day practice. So Dr. Elder, you can take over.
Thank you so much, Dr. Sean. It's great to see all of you. And I'm so happy that you're all at the Raj and at MIU and having this very profound and intimate exposure to Ayurveda. So we're going to talk about, Dr. Leslie and I, chronobiology and dinacharya, the science of the rhythms of nature. And as you've heard, our aim is to give you, and one of our aims here is to give you a little taste of our fellowship program. We devote, Dr. Leslie and I, along with our colleagues, a lot of our time and energy to teaching our fellowship in Integrative Medicine and Ayurveda, a 2-year distance learning training program leading to an MS degree. And it's very practical. It's practical clinically, and it's practical in terms of self-care. And the program is recognized by the American Board of Integrative Medicine. So physicians completing the program are eligible to become board certified in integrative medicine. So what we'll do now is we're just going to give you a little taste, really, of a typical lesson from our fellowship, if you will. And you'll find it to be very profound, yet very simple, yet very elegant, and very practical, both for your own self-care and for the care of your patients. So you'll come out of this next 45 minutes to an hour with some really practical things that you can tell your patients that are transformative. And what we'll do is Dr. Leslie and I will tag team it. She'll give you the approach from the way of thinking about the topic, the subject, from the vantage point of Vedic science. And then I'll chime in with some of the modern science, and we'll go back and forth, weaving them together. Dr. Leslie.
Hi there, Dr. Leslie Elder, and I worked as a Kaiser physician for many years, and then I also had a private practice in Ayurveda, and now I'm teaching this course. So good to see you, and glad you're immersing yourself in the wonderful experience of being at the Raj, where you're actually experiencing the healing of Ayurveda through all the techniques that they have of cleansing and the diet and the daily routine there. So here we have in this slide, just a basic slide about representing the 3 basic doshas. These doshas represent the general principles of nature. So we have Vata dosha, and this is the wind, the air and space. Then we have the Pitta dosha, and this represents fire, and you might see it in like a volcano or just fire in general. And the sun, of course. Also, you have Kapha dosha, which represents the heavy principles of the earth and also water. This is a heavier dosha. Now, so our bodies reflect nature. We're part of nature. So in our bodies, Vata represents the movement, any movement in the body, the movement of, the blood through the vessels, the movement of thoughts through your mind. This is all a Vata activity. Pitta dosha in the body represents your digestive fire and your metabolism. Kapha dosha in your body is the solid structure of your body, the bones, the muscles, just the physical structure of your body. So this is we're going to be talking about this and applying it, showing you how you can apply this to your practice when you're dealing with not only self-care, but taking care of your patients.
Next slide.
Yes. Okay, here we have a clock, and this is really it's like the natural clock of nature, and there's these times of the day that are really optimal to perform certain activities. So if we perform these certain activities during these times of the day, we'll get the support of nature, because these times of the day are really naturally meant to do these certain types of activities. For example, from 2 a.m. to 6 a.m. in the morning, there's a wave of wakefulness that just moves around the world. And so this is a light Vata predominant time of the day. The birds start singing early in the morning, and then this is the best time to get up. And it's really it's optimal to be getting up before 6 a.m. because it's a light time of the day. A lot of Vata is a light dosha, and it's easier to get out of bed. If you sleep into the next section of the clock on the left bottom, that's 6 a.m. to 10 a.m. That's a kapha predominant time of the day. It's heavy. Remember I said kapha has to do with heavy structure, etc. And this is heavy. It's hard to get out of bed that time of the day. You might feel groggy. You might need to really gulp a few cups of coffee or tea to get yourself awake. That's to get up by 6 a.m. So, and then we go around to the next part of the day at the top, which is 10 a.m. to 2 p.m. This is a pitta predominant time of the day. And this has to do with metabolism. Remember, it's the fiery principle of nature, pitta, and it's the time of the day where it's best to digest some food. So, in fact, the very middle of that cycle is at high noon. And that's the best time to eat your main meal of the day. Your heaviest food should be at around 12 p.m., or at least in this time of the day, from 10 a.m. to 2 p.m. It's the pitta time of day. Now we're going to go around the clock one more time, and it's going to be more of the evening, late afternoon, evening cycle. We're going to be in early morning cycle. So the next time of the day in the afternoon, late afternoon, is 2 to 6 p.m. Now this is it's a Vata time of the day. We're going around once more time around this clock. It's so late afternoon, early evening is a Vata time of the day. It's kind of has that light Vata characteristic about it. It's the best time of the day to actually do mental work. So because of that lightness, your mind is quick. The thinking is optimal. So this is the time of the day to do mental work. And then we get down to 6 to 10 p.m. And this is a heavier time of day. Once again, it's kapha time of the day. And this is the best time of the day to start thinking of winding down. Everything's winding down. Your digestion is slower. You should have eaten before this time optimally. And dinner should actually be not such a heavy meal, maybe an easy to digest meal. That's to eat 6 or around that time, 6 p.m. And so it's best also to get in bed during this kapha cycle to go to sleep, because it's that heavy kapha influence is there. You want to be in bed optimally by 10 p.m. so that you can have that kapha quality that will carry you through the night to have a nice sound sleep. And so because by the time you get into the second pitta period from 10 p.m. to 2 a.m., that's a pitta time of the night, and it has something to do with metabolism, but not metabolizing food that you've taken in. Instead, it's metabolizing all the byproducts of digestion. It's a time that it's a cleansing cycle. Ayurveda, we think of this as a time of the day. The cleaning crew comes in. You're just, finishing your metabolism, cleaning the slate so you can get ready for the next day. So if you're going by this cycle, if you're following this cycle of nature, you will automatically have a better experience because you're going to be flowing downward in the river of life rather than trying to paddle upstream and struggling against the forces of nature.
Thank you, Leslie. So, well said. So, Ayurveda, since time immemorial, has described a biological clock, which dictates when the schedule of the physiology. There is nowadays a science, chronobiology, which people didn't talk about when I was in medical school, but people are talking a lot about chronobiology now, which is the modern awareness and scientific exploration of the daily rhythms and seasonal rhythms of the body. So as we see on the slide, the suprachiasmatic nucleus in the brain is the body's main timekeeper. And it gets its clues from the sun through the retina, just as we learned from the Ayurvedic clock. It's based on the sun, right? With the pitta time of day being when the sun's highest in the sky and so forth. It's all based on that daily cycle of the sun. The suprachiasmatic nucleus takes its cues from the sun through the retina and outputs rhythms to the physiology and to the mind. Let's read through and take a little closer look at this. I'm going to read the comment. This is from Voigt and colleagues, published in Gastroenterology and Hepatology in 2019. It's very nice, and I'm just going to read it. It makes the point very well. Entrainment of central and peripheral circadian clocks. Light entering the eye is a primary factor in training central circadian rhythms in the suprachiasmatic nucleus in the brain, known as the master pacemaker. That's repeating what I just said and what we saw in the previous slide. The central circadian clock sets rhythms in peripheral tissues using a variety of methods, including fluctuations in temperature, hormone production, behaviorally via activities such as rest, activity, sleep, wake, and fasting, feeding. And now notice this last sentence. Circadian rhythms in the intestine can also be influenced by time of eating independent of input from the central circadian clock. So not only is there a central clock, which gets its clues from the sun, it has been found that all of the peripheral organ systems likewise have their own clocks. In the case of the gut takes its clues, its cues from when you eat. So if you're eating at the right time, then your gut is on schedule and your brain is on schedule and everything is going harmoniously. But if you eat at the wrong time, if instead of having your rice and dal and paneer and whatever you're having at lunch, if you're having a huge meal for dinner or at night, then excuse me, sorry. Then the gut clock gets off whack, and then the gut clock and the central clock are not functioning harmoniously. The physiology is out of tune, and metabolic dysfunction can ensue. So this is an important idea in terms of for all the organ systems, including the gut, the gastrointestinal system. The 2017 Nobel Prize in Medicine was awarded to a trio of investigators, quote, for their discoveries of molecular mechanisms controlling the circadian rhythm. And I include this slide just to point out that chronobiology has come into the forefront and is now big news. Okay, so we'll start now, and we're going to talk about 3 activities. Leslie already alluded to them. We'll go into more detail into each, when to do them and why, according to Ayurveda, and then we'll look at some of the supporting evidence.
Okay, here we see Agni. This is the key concept. A very key concept in Ayurveda is Agni, the digestive fire. So in nature, Agni is represented by the sun. And really the energy of the sun is just makes everything grow. It's the source of dynamism and evolution everywhere in nature. And in the human body, the Agni is really synonymous with the digestive fire, Jathar Agni. This is Agni in the individual physiology. And this is the source of all transformation. It's the source of digestion and metabolism in the individual physiology. Very, very important. In Ayurveda, we want to optimize digestion. We do everything to optimize digestion by following that clock, that natural clock that we see in nature. And as Dr. Charles was mentioning, that we really need to sync our inner clock that is from the natural clock. We have to sync that with our daily routine, our dinacharya. Then that optimizes the digestive fire and prevents us from you want to do everything you can because this is really the source of your health, having a strong Agni. And if you don't have a strong Agni because of your problems with the daily routine isn't proper, improper food, etc., you can produce what we call digestive toxins or ama.
Main meal and lunch.
Oh yes, very important that we have, the main way we do this is by having our lunch, our main meal of the day, when Agni is highest, when the sun is at the peak of the sky and our inner digestive fire is at its highest point. So we want to eat our main meal at lunchtime. Oh, here we have a slide talking about ama. So as I mentioned, ama is really synonymous with digestive toxins. Ama is incompletely digested food. So if we don't eat at the proper time, we end up not doing a very good job digesting the food, and we form this ama digestive toxins. And signs and symptoms of ama are just feeling blocked, and actually that we can have blocked channels in our body, so things aren't flowing properly. We feel a heaviness in our body. It causes a vata dosha to be disturbed because it can't move through the system properly. Actually, even blood flowing through blood vessels, you can get coronary artery disease. It's like a blockage of the vessels. This is actually in Ayurveda thought of as being like ama in your blood vessels. Indigestion is the food is not flowing properly through your digestive tract because the digestive fire isn't strong enough. So we get problems of digestion, constipation. You have obstruction of your digestive channels, and this is due to improper digestion, buildup of ama. You can also just have not good energy and mental and physical fatigue, just all due to this ama in your system, and that's caused by improper digestion.
So then, just to repeat that, to summarize, that when the sun is highest in the sky is when Agni is strongest. The sun is in the universe, Agni in ourselves. Sun is highest in the sky, Agni is strongest. Eat your main meal midday. Don't eat so much at night, a cornerstone of the Ayurvedic routine. Okay, so what we'll look at in this slide is a little complex, but if you look at the photo, there's 2 little mice in the bottom. And this is, you see the reference here, the daily eating patterns and their impact on health and disease, published in Trends in Endocrinology and Metabolism. And this is from laboratory rodents. And looking at the considering the impact of time-restricted feeding versus free feeding. So in the case of the laboratory animals, they can be fed when they're supposed to eat, which in the case of rodents is at night, or they can be allowed to eat whenever they want. And all I want you to see here is at the very left, I don't know if you can see my cursor, that there are data suggesting that there is an impact on a negative impact of free feeding as opposed to eating at the right time at the levels of the gut microbiome, at the levels of luminal metabolomics, at the level of gut signaling, and at the levels of hepatic gene expression shown in experimental animals. So this works at multiple levels mechanistically in the physiology. Here's some clinical trial data in humans, of course. What is the effectiveness of time-restricted eating? That is to say, limiting dietary intake to a consistent 8 to 10 hours without mandating calorie reduction to improve cardiometabolic factors in adults with metabolic syndrome. So in this trial, they randomized 108 adults to standard nutritional counseling or time-restricted eating, and they were told you can eat 8 to 10 hours. You can only eat within an 8 to 10 hour window, and you have to stop eating 3 hours before bed. Okay, so if someone's going to bed at 10, that means they can start eating at 10 in the morning, 11 in the morning, like that, and then stop eating at 7 p.m., right? So this went on for 12 weeks, and the time-restricted eating group showed improvements in A1C, statistically relative to the standard nutritional control. Now, if you are assuming, so far as I can tell in this trial, they didn't tell people when to go to bed, but assuming a reasonable bedtime, then people are fasting in effect from 10, 11 o'clock at night until 11 or noon the next day. And then, taken from personal experience, if you do that, you're hungry at noon and you're going to eat. Okay, here's another trial, time-restricted eating again, change in body weight and energy intake between groups over 12 months. And in this study, there were 3 groups. It's a weight management trial. There's a control group, no intervention. There's a TRE, time-restricted eating group, which is the orange line, and there is a caloric restriction group, which is the blue line. And here for the time-restricted eating group, you can only eat between noon and 8 p.m. Okay, so you stop eating at 8. All right, from experience, if you stop eating at 8 and you skip breakfast, at lunch, you're going to have your main meal because you're going to be very hungry. And what we can see here is that both groups do better than no intervention. And the time-restricted eating is pretty close to caloric restriction in terms of success at weight loss and pretty good weight loss maintenance here. And this was, people have a hard time dieting and, cutting down the calories. Very simple recommendation in my practice. People come in that want to lose weight. Eat your main meal at lunch, eat like a bird at night. Don't be so worried about calories or eliminating foods that are supposedly bad. Eat what you want in a mindful way at lunch. Don't eat so much at night. And if that's not in your habit, the data suggests you're going to lose weight, which is what the Vedic knowledge suggests as well. You might want to check out these references, which are nice reviews of this topic, of the circadian clock and its role in nutrition and metabolism. We're just skimming the surface in this talk on this very in-depth and well-researched topic. Gut motility is better during the day than at night. Insulin levels and plasma blood sugar levels are lower during the day than at night, because insulin resistance is lower during the day or at night. So if you have a group of patients, your patients or a group of study participants eat a meal at lunch, you have them eat the same meal at 10 o'clock at night, same food, same people, same meal. blood sugars will go higher at night. Saliva production is higher during the day than at night. So the physiology is primed for that meal during the day, midday, not at night. This is an interesting trial published in Chrioniobiology International a little while ago in 2003, where the investigators took subjects and exposed them either to bright light or to dim light. Experimental subjects, those exposed to bright light, showed improved carbohydrate absorption and stomach muscle electrical activity. In cross-sectional epidemiologic studies, scientists have shown an association between late night eating and increased risk for heart disease, obesity, and metabolic syndrome. And as if the case hasn't been made already, obesity is a big deal, and metabolic syndrome is a big deal. Here we see that in the United States in the early 60s, the average BMI for a man was 25, and in these data are from 6 or 7 years ago, published in 2022, the average BMI was 29.5. So it's really all hands on deck as far as working on this challenge, and we cannot afford to not be discussing the timing of eating with our patients. So eating is a big deal. Another big deal is sleep, and the two are physiologically linked, as we'll see. But first, Dr. Leslie will give you the quick lowdown on the timing of sleep.
Okay, so here we see the clock again. This is the clock of nature, also reflected in our bodies, our physiologies, and we see this cycle going around the clock, and that we talked about at 6 p.m. to 10 p.m. This is a heavy kapha time of the day, and that we really need to be in bed. According to Ayurveda, it's best to be in bed by 10 p.m. and even earlier optimally to catch that kapha, that heavy kapha energy that's really predominant in that period between 6 and 10. You want to catch that energy, go to sleep during that time, and it'll carry you through the night so you'll have a sounder sleep. And it's so important to be asleep during that time. You don't want to be up because you want to be distracted. You want to be digesting, doing the, cleaning, you're going through the cleansing cycle of metabolism, and then getting up by 6 a.m. And this is the best time to wake up so that you catch that light feeling of the Vata time of the day that's between 2 and 6 a.m. And so it's very interesting because if you do not, I just want to mention this because a lot of people experience around 10 p.m. when they're supposed to be going to bed, they experience a wave of, and if they're still awake, they will experience this pitta, this metabolic energy that's part of pitta dosha in the nighttime. This pitta dosha is going to be starting to metabolize the food that they've eaten during the day and kind of go through that cleansing cycle. So you've got a lot going on in your body and the gut. It's for cleansing. But people will experience that mentally if they stay awake past 10 or even around 10. They'll feel it as a mental activity, which is very exciting. It's like they're feeling like they're getting a second wind, and they'll interpret that as being, oh, it's time, this is so interesting. I've got to finish this project and get involved in some kind of mental activity. But you really need to be bent by then and not taking on some other project, because then you won't have that feeling of, oh, you won't experience it mentally. You'll instead just be doing what you're supposed to be doing, sleeping while your gut works to finish off the metabolic process. So, if you don't follow this dinacharya, you don't follow this routine, what happens is that you really run into risks, and because we're really not nocturnal. Human beings are not nocturnal. Bats are nocturnal, but people aren't. So, and we can't really change this as much as we would like to without running into problems. And Dr. Charles is going to talk now about some of the risks that you can have, especially for people working the night shift.
Get to bed by 10. Simple message. Wake up by 6. And then you're paddling your canoe with the current. And then the further we stray from that, about, 10, 9:45, whatever, 10:50. Okay. Bed by 10, up by 6. the further we stray for that, the more we're stressing the system. So this slide, these are meta-analysis data. Excuse me. It's a forest plot of night shift work and total cardiovascular disease, mortality. So this is meta-analysis data published in Frontiers in Public Health just a couple of months ago. And in case you're not used to looking at these forest plots, it's a forest plot. What they did was they crunched, they searched the literature, found appropriate studies, and then they merged the data and they did an analysis of a big data of all the data combined. And we have 638,255 participants total in these 9 studies. And so what do the data suggest? And here, this vertical line in the middle, above the number 1, that's the sort of baseline, let's say. And you can see for each of the studies, so for Chang et al., the first study, you can see that the blue line is all to the right, of the vertical. This suggested in that study showed increased risk of cardiovascular disease mortality in the subjects, and so on. You can see all the studies but one fell to the right, trended to the right of this vertical line. And here's the sum total data. You can see this diamond here. It's clearly to the right of the vertical line. This is suggesting and it doesn't overlap the line. So this suggests a significant association. And in fact, we see here the number 1.27. So you've got essentially a 27% increased risk of cardiovascular disease associated with night shift work. Okay, this is printed here up the conclusions from a monograph published by the International Association of Research in Carcinogenesis. This is a World Health Organization body, and they published this monograph about 5 years ago, Identification of Carcinogenic Hazards in Humans. If you're interested in the topic, it's a very 400-ish page monograph. I would recommend it. And here was their conclusions about night shift work. There is in cancer in humans, there is limited evidence in humans for the carcinogenicity of night shift work. Positive associations have been observed between night shift work and cancers of the breast, the prostate, the colon, and the rectum. There is sufficient evidence in experimental animal models for the carcinogenicity of alterations in the light-dark schedule. There is strong mechanistic evidence in experimental systems that alteration in the light-dark schedule exhibits key characteristics of carcinogenesis, based on evidence of effects consistent with immunosuppression, chronic inflammation, cell proliferation. Overall evaluation, night shift work is probably carcinogenic to humans. Okay, association of night shift work and the risk of type 2 diabetes, published in another meta-analysis published in BMC Endocrine Disorders in 2024. And it looks a little bit like the same pattern that we saw in the previous meta-analysis for cardiovascular disease. In this publication, 10 studies, 200 total of 235,800 participants, and we can see the diamond here is to the right and not overlapping the vertical here. And again, 30% increased risk of diabetes associated with night shift work. Okay, the whole physiology is connected. And we said that there is a direct, we've seen that in both Vedic and modern science, there is a link between the natural rhythms and digestion and metabolism. There is a link between the natural rhythms of the sun with sleep. And all of these are linked to health. Not surprisingly, there's a direct link between metabolism and sleep. So there's an interplay. And so here we see these are data published in PLOS Medicine. And here we see on the x-axis, it's cut off a little bit, the average nights, right, the average number of sleeps per night. This is in a cohort of 1,000 people in the Wisconsin sleep cohort. And we can see here this U-shaped curve on the x-axis, adjust the BMI. And so the BMIs in this group were high, but we see that the best BMIs were in the group sleeping just south of 8 hours a night, a little bit worse if there was people who were sleeping 7 or 8.5 hours, and much higher BMIs higher still in those sleeping 6 hours or those sleeping over 9 hours a night. So sleeping the right amount associated with the best BMI. And there is a well-described neurohumoral mechanism explaining this through the hormones leptin and ghrelin. As you may remember, ghrelin is the hunger hormone, leptin is the satiety hormone. And we can see here in both graphs on the x-axis average nightly sleep in this cohort. And then the hormone levels were measured. And as sleep goes up, leptin levels go up. That's the satiety hormone. As sleep goes up, ghrelin levels go down. That's the hunger hormone. So get to bed on time to control your hunger and metabolism. Now, these are, again, to the same point, these are data that I published 10, 15 years ago in the International Journal of Obesity. And these were, we were recruiting participants for a weight management study, both weight loss and then weight loss maintenance. And in order to qualify, we had 475 people enrolled in a weight loss program who had to lose at least 10 pounds in order to move into the weight loss maintenance phase of the study. And you can see here, and we collected baseline data before they entered the weight loss program. You can see here that these two groups of bars in the middle are higher than the groups of bars on the side. And what this is telling us, this is sleep time on the x-axis. And what this is telling us is that those who were sleeping between 6 and 8 hours a night had a higher likelihood of success at weight loss in the weight loss program relative to those who were sleeping less than 6 hours or more than 8 hours. And then within each of these groups, you see there's four bar graphs which are describing stress scores, PSS, perceived stress scale scores at baseline. And we can see that within each sleep group, the lower the stress score, here we have PSS of 0, the higher the weight loss. And the higher the stress score, the lower the weight loss. So stress is also related to our ability to lose weight. Here is a data that we published in the Permanente Journal in 2014, illustrating the impact of transcendental meditation instruction on, in this case, employee health. These were teachers in a very stressful situation. They were employed and teaching at a residential school for at-risk youth. And those who learned TM versus weightless control showed improved PSS, perceived stress scores, as well as improved scores in depression and burnout. So all of these things, stress, sleep, diet, the timing of all of the above are critical to proper metabolism and health. And now we'll add one other factor, which of course we always talk about with our patients, that's exercise.
So exercise is a great way of reducing stress. But you need to, what kind of exercise should you do? And when should we do it? So Ayurveda gives very important information to let you know, to find out what is the best exercise for you. if you are predominantly Vata dosha, you know, Vata tends to be light, and people who are predominantly Vata tend to be a little bit more, they could be more vulnerable to stress in a way because that lightness. And so they need to favor calming exercise. The best exercise for someone who's predominantly Vata would be walking, yoga, dancing, exercise that doesn't add more stress to the system. You know, you might see occasionally you'll see someone who's out there running marathons or ultra marathons, extremely thin, like overly thin, and looks very Vata. It's probably not the best exercise for them because it's you know, the thinner physique, et cetera. It's a lot of all that impact, et cetera. That could be adding stress to the system rather than taking it away. We want our exercise to actually take stress out of our system. So if you are a Pitta type, because Pitta is fiery and hot, excuse me, Pitta types should favor more cooling exercises. Not only cooling as far as like, you know, maybe skiing or swimming, which is very cooling, but also mentally cooling. You don't want to be involved in real hard competitive exercise where you're just trying to kill your opponent in a tennis game, etc. That could aggravate uh, you mentally. So we're talking not only about mental, but also the physical effects of exercise. So Pitta's, you know, Vata has a more of a lighter exercise, Pitta more medium, and then Kapha, people who are predominantly Kapha tend to have more heavy, sturdy muscular physiques, and they tend to be considered to be the most athletic, classically athletic types, body types. Uh, so picture a football player or, you know, a professional hockey player. Uh, so Kapha, because of that heavy nature of Kapha, if you are predominantly Kapha, you might feel sluggish and you need to have a little bit more stimulation, and exercise can really provide that. You're really the opposite of the Vata predominant type. You need stimulation, you need to really get yourself out there and exercise on a daily routine. Even twice a day is optimal for many people who are Kapha, especially if you need weight loss. So stimulating exercise like jogging, tennis is fine for you. You know, soccer, kicking a ball around, you know, joining a group of you know, a soccer association, etc. These kinds of exercises are very good for kapha. Swimming also can be good, and also the water can keep you afloat more easily if you're kapha because you have a higher fat component to your body. And the other thing that's very important to remember is the best time to exercise is during the the best time to exercise is between 6 and 10 a.m. in the morning because that is the kapha time of the day. And that is the time that really favors your physical body. It has that heavy characteristic. It supports physical exercise. And studies do show that people who exercise early in the morning are less prone to exercise. I'm sorry, less prone to injury. So exercise early in the morning's best. The second best time to exercise is between 6 and 10 in the evening, 6 and 10 p.m. in the evening. This is also the kapha time of the evening.
Good. Okay, very good. So get up early and exercise. We're not the first people to say that, right? We've all heard that. So this is an interesting, these are data from the NHANES survey, 2003, 2006. And respondents were asked, survey recipient participants were asked about their exercise habits. And we're looking here at MVPA, that's hourly, that's moderate to vigorous physical activity. And what this slide is showing us is when do people exercise? Out there in the real world, when are people exercising? And vigorously, and those who do exercise vigorously. And we see here that there is a modal pattern to the data. There is one group, the solid data, they exercise in the morning. They must have gone to Dr. Leslie's lectures and they saw that they should be exercising between 6 and 10 in the morning, and bingo, that's exactly where the curve is. Then there's another group who are making the mistake of doing vigorous exercise during their lunch hour, it appears, when they should be eating. And then there's another third, and that's this line, the midday line. It's I'm not sure if you can see my cursor, but that's the dashes. And then the dots, the dotted line, the third line, you can see peaks around 6, 7 o'clock at night. These are people who are exercising at night or after work. Okay, 3 groups of people in terms of when they exercise. Now, these curves, and the curves are the same, except they're the same data, different regression models. So we'll just look at the bottom curve, the joint association of the diurnal pattern of the level of physical activity with BMI. So on the y-axis, you have the body mass index. And on the x-axis, we have total amount of rigorous physical exercise in minutes per week. And what we can see clearly is that the solid line, the morning curve, is lower than the other two, right? It's below. So in other words, at all levels of exercise, no matter how many minutes, those who are exercising in the morning, this is associated with a lower BMI than those who are exercising later in the day. And in addition, very interesting, you can see that this lower curve is linear and the others plateau. So in other words, if you're exercising vigorously at midday or evening, well, that's great. But in terms of weight, at least by association, once you get to around 2 hours of exercise a week, good. Beyond that, it's not continuing to help you very much. A little bit, but that slope is not very, of those 2 lines, that dotted and dashed lines are not very steep after about 120 minutes, whereas those exercising in the morning continue to gain advantage with more and more exercise. Morning exercise is more effective at burning fat than evening exercise. So these are data collected from humans, of course, energy expenditure during exercise. And let's just look at the middle bars, showing fat expenditure, exercise before breakfast, EBB, exercise after breakfast, EAB, exercise before dinner, EBD, exercise after dinner, EAD. That's these purplish line, this purplish set of bar graphs in the middle, and it's very clear that there is more fat expenditure, more fat burning for those exercising around breakfast in the morning than those exercising in the evening. Okay, a fair amount of the research in this area focuses on the impact of exercise on sleep, and that in turn focuses on the impact of when we exercise on the melatonin curve. So we will start releasing melatonin about 2 hours before our habitual bedtime. And this can be measured in terms of salivary melatonin levels. And here we see that especially in people who, these are data from, this is circadian rhythm phase shifts caused by timed exercise. And here it varies with chronotype. This is, okay. And so we see for those who tend to wake up early in the morning, if you then exercise in the morning, this will lead to a phase advance in the internal circadian rhythm. Melatonin release and eating will start earlier. If you're exercising in the morning, you're more likely to go to bed earlier. Whereas if you are exercising in the evening, that causes a phase delay in the melatonin release, and you're going to fall asleep later. Now, in this particular study was true for quote unquote early chronotypes, those who tend to wake up early, and the effect was a little different in late chronotypes, where if you're sleeping until 10 in the morning, then exercising at night is both in the morning and at night was beneficial in terms of your circadian melatonin release. Okay, so let's summarize what we've talked about. The daily routine, we talked about sleep, and we've talked about food, and we've talked about exercise, and we've talked a little bit about stress, and it's all very simple. I mean, the way we can summarize this, early to bed, early to rise, exercise in the morning, and have a good lunch. Next day, early to bed, early to rise, exercise in the morning, and have a good lunch. That, in a word, is the essence of the dinacharya, of the daily routine. And it's the picture of health, as suggested by, this is the book that Leslie and I published a few years ago. And then and this is supported, we see, by contemporary data. It's really the basis for health in Ayurveda. And then if you add to those four things, meditation twice a day for the stress reduction, early to bed, early to rise, exercise in the morning, eat your main meal a day, which means don't overeat at night, and do your TM meditation twice a day. Now, if you can get your patients on that routine, there's going to be a lot of unemployed doctors. Okay, but not us. Our practices will thrive because
Yes.
everybody will be coming to us for this advice.
So no worries.
Which seems to be common sense for the most part. Okay, questions?
Well, thank you very much.
How do you explain a whole bunch of people who are night owls, especially
Okay.
in this culture?
Yeah. Yeah.
Oh,
Kids, they-
it's what I talked about. People, so that's the nighttime, like starting at 10 p.m. to 2 a.m. is a really, if you're awake during that time, if you stay up past 10, you will get that energy of, it's supposed to be metabolic energy. It's supposed to be energy that your body is trying to, wrap things up, finish off metabolism of the food, and cleaning the slate, cleansing processes are going on. That's energy that you're feeling in your body. It's meant to be a cleansing energy. If you stay awake into that period, you will feel it mentally. You will feel that mental energy. Most people have felt that feeling of getting a second wind around 10 p.m. where, wow, this is really interesting. I've got to do this project. I've got to watch something on TV or looking at my phone. And I think that's why people get into that whole night owl cycle. Plus, it's really been worsened by all of our gadgets, the availability of all this, this news in the nighttime 24-hour cycle. Yeah, it's an interesting phenomenon, and unfortunately, I think it's getting worse.
It's a bad habit.
It's a bad
The
habit.
joke that I would tell my patients, this is that there's no such thing as a person who's a night owl anymore. If you saw a bat flying around in your backyard at high noon, and you went to call the health department, the bat's got rabies, the bat says, "No, I'm a day bat." No, there's no day bats, and there's really no night people, except unlike the bat. I mean, we can choose to do the wrong thing.
And the only reason we're able to do it is because of electricity. Like if people weren't able to do this 150 years ago, it was really pretty impossible. But it's allowed us to make the wrong decision. Technology can tempt us to make the wrong decision, and as human beings, we can tend to do that maybe more often than we should.
We hear a lot of reports on intermittent fasting. Most of them are very beneficial, but lately some reports are coming that intermittent fasting is not good.
Intermittent fasting.
Something about intermittent fasting.
Yeah, so the data on intermittent fasting are controversial, very good, and that's a fair point. And nobody does studies that I'm aware of that ask exactly the question we're asking, right? Have your main meal at noon,
Right.
light dinner, breakfasts plus minus. So every patient, so a couple of things. So what we are suggesting is to eat during the day less a night. And the intermittent fasting studies gives us some data. It's similar. In reality, different patients are different. And this is one of the problems we run into in the allopathic literature and the clinical trial literature, is that everyone is grouped as one. We don't understand that we don't the
Time.
not only the timing,
Biology.
but different people. We have different body types. What's good for a kapha type is not so good for a vata type, is not so good for a pitta type. So, for example, I will tell my patients who have ama, toxin accumulation, to do a 24-hour liquid fast from noon to noon. So you have a normal lunch and then only liquids until lunch the next day. We're not saying no calories, just nothing solid. But how often they should do that depends on the patient. If someone is a kapha type, do it every week. If someone is a vata type, every month or two. And so in Ayurveda, we tailor the interventions to the pulse, to the physiology, to the body type. A lot of the clinical trial data that you get that we'll find in Ayurveda will fall short because it's, everybody's being treated the same. In a Western study, a typical clinical trial, everyone's treated the same. Whereas, no, it depends on the constitutional type, their Agni, their
They might not be having lunch as their main meal of the day. They might be just having a big dinner and then fasting the rest of the time. So that's also a very important point that to pay attention to the timing of the meal.
The other thing I would mention is that we don't, in Ayurveda, in Ayurveda, as both an integrative medicine and physician and an allopathic physician, I've gone a lot by experience. In allopathic medicine, it's less fashionable to cite that. You're supposed to cite data. But in Ayurveda, it's self-referral. Our own experience counts for a lot with ourselves and with our patients. And I cannot tell you, don't eat so much at night, have your main meal at lunch. That and one or two other things. In Ayurveda, cook your food, not raw. Okay? Things like that. So I'll have patients come to see me. They'll be referred to me from gastroenterologists. They've been scoped, they've been scanned, they've been treated, and they're still having their functional bowel symptom. They're eating too much at night. They don't even know that's wrong. Don't eat so much at night. Have your main meal at lunch. Quit eating raw foods, especially at night. Just 2 or 3 suggestions. And sometimes, and they get better. Not 100%, they get a lot better. And sometimes I've had the experience where the gastroenterologist will copy me their chart notes. Patient went to Integrative Ayurveda clinic and is now better, and send me a note thanking me. And I just told them not to eat so much at night.
Thank you, Dr. Charles. I think anyone else?
Thank you.
This was really an eye-opening, especially you kind of supported the advice of biological clock through some of the studies. I think that was very impressive. And we want to thank you